As a scientist, I was taught to ask questions and to seek answers. And there's a basic question, which is, do we have enough providers to take care of the population in our community right now? Fresno in the Central Valley is anticipated to be one of the most growing areas in California. And if we're already behind in the number of physicians, I struggle to see how will we ever get in front of a growing problem. As an emergency physician, I was starting to feel overrun. Every day feeling as if more and more patients were being sent to me in my department and not adequately providing health care in an efficient, cost-effective manner. I feel as if there's improvements in the system and that our voice needed to be heard. And so I decided to leave my practice and run for office and do this crazy thing of chasing your dreams. But I was born and raised here, in this community. I was raised in disadvantaged communities where we don't have the same opportunities in life. There's a social injustice which happens every day, right here in the Central Valley, that lives are shortened because we don't have access to care. And so my hope today is to talk and hear from people in our community about how we could improve access to medical care. What does that look like? What could we envision that system to be like, and how do we build it? What I want to make sure we don't do is that we don't put the cart in front of the horse, that we're in such a rush to fix the problem that we haven't done our homework to make sure we're implementing it well. What would we learn from other best systems to create a medical education that we could be proud of here in the Central Valley? Now, I don't pretend to have all the answers. That's why I brought all these smart people to the room, so that we could listen and hear and come up with those solutions together. But I have a hope, which is that our future physicians looks like and sounds like the community that we come from. The state of California has 40% of its residents who speak a foreign language, and yet less than 5% of our doctors do. It's hard for us to be able to communicate and build the trust we need in our profession to provide services if we can't talk with them. And so we have to find a way, when we're thinking about education, that we're educating our community to stay within our community. Fresno has suffered from a brain drain for a long time, for as long as I've been here. And how we can strengthen anchor institutions that are in our backyard right now, how we can find ways to partner with them to be creative, we should be looking to do. But I have to tell you something about me as a person. I was trained as an ER doctor. I actually don't have a whole bunch of patience. I use the pun, and I'm sorry for it, but I took care of a lot of patients. I never learned patience. It's hard for me to accept the fact that I have to wait years to get things done. That when we were talking about the Affordable Care Act, and we knew that there were going to be more people enrolled, that we weren't training more people ahead of time. It's put us behind already. I think having the patience to wait years is not going to do us any good. I think we have to answer these questions as soon as possible, but we have to do it in a cohesive, community, thoughtful pattern. So I just wanted to thank everybody for coming today. I'm excited to hear what we have to say and hopefully what vision we can get accomplished. I pride myself on the fact that when I got to Sacramento, I didn't introduce any bills this year. They weren't my ideas. I was carrying forward what the community wanted. I'm a better running back than I am a quarterback. And if you give me a good play, if you tell me what you want the medical school to look like, I hope to return with that vision. Because I understand the need is there, and we all have to figure out how to get there together.
Last year, in the beginning of the year, Latinos became the largest ethnic community in the state, but we continue to suffer significantly in terms of disparities, numbers of physicians that identify themselves as Latinos. And so that number hasn't changed much since I was in medical school, unfortunately. And we worked diligently. We did a lot of work, and Kathy Flores is here, who was one of the people that worked with us to identify ways to bring students, not just Latino students, but underserved students from underserved communities, to really look at the health professions. Being able to come here today to be part of this discussion and to continue, the discussions that will eventually lead to, things like a medical school in Fresno, which we are very, very excited about, which can, identify the issues here that are relevant to Fresno, pertinent to Fresno, and be able to focus not only just providing physicians, but providing other healthcare providers, and looking at the research that needs to happen so that we can move forward.
We were created as a regional campus for UC San Francisco in 1975, and it was to begin to address the issue of we're a rapidly growing part of California and we're a physician underserved part of California. And here, almost 42 years later, both of those things are still true. We were focused on developing graduate medical education for production of physicians, in part because the lag time between taking a student or a graduate in and when you actually have a practicing physician is much shorter when you start with somebody that's already graduated from a medical school. We've grown significantly over those 41 years. We currently have in excess of 320 physicians who are training as residents or as fellows, that is, physicians who are training in subspecialties such as cardiology or minimally invasive surgery. We're also very happy to report that as we look at what our outcomes are, we're retaining in excess of 50% of those physicians that stay within the Central Valley. But one of the things that's clear for us, and it's also clear as you look around the country, is one of the most important determinants about where that physician will practice is where they finish their training. So that's why we've tried to expand into additional subspecialty training and things so that those physicians that would leave the area to go get that training and we subsequently lose them to the Central Valley, that we will retain them in the Central Valley. The other thing that's very important is that you're recruiting people into the program that already have ties to the region, that have a certain competency dealing with the patient populations that we have within the region.
Our feeling is that a success is not just becoming a doctor, but it's becoming a professional who is willing to come back and work within the community and raise the level of all areas in the community, health included, of course.
And I came to UC Merced for more or less the same reason that a lot of people come to Merced, which is a unique opportunity to build a new research university to provide that kind of an education to what's largely been an underserved population of students. I think we all know in this room that there has always been discussion of the role that UC Merced can play in a medical school. And while I would say there probably is a medical school in UC Merced's future, I think it's in the rather distant future. And I would ask everyone to just try to put our campus in the perspective of other outstanding medical schools within the UC system and how they have evolved and how they focused very specifically on building a very strong foundation of a comprehensive university with strong science and engineering and math and social science programs around which these other programs could be built. So our focus right now, very much so, is in the area of public health.
Debt levels that our UC graduates are leaving with, right? It clearly influences choices if you're hundreds of thousands of dollars in debt, notwithstanding your interest in primary care. And the AAMC provides information to students about how to finance their medical student debt, almost like a second mortgage over 20 to 30 years, and how shocking and stressful is that. So I'm familiar with the federal loan forgiveness programs, and we have a number in this state. What the Riverside School of Medicine refers to these as is or mission-based scholarship. So these are awarded to students on admission, and they're really not a scholarship. They really are a loan forgiveness. But the premise is, if I'm a donor, and this is my student, and he's admitted, that he'll know that he graduates from Riverside. He then completes his residency, and there's no requirement that residency be completed in the Inland Empire, because the Inland Empire does not have robust GME as yet. It needs it, but it's not there. So opportunities for the Riverside graduate to leave. But if the Riverside graduate comes back to the Inland Empire and remains in practice for 5 years, the debt is wiped away. So 5 years for 4 years, paid annually, so you do leave with the debt, but both the debt, both the principal and the interest are repaid in full. So for those students who know they want to come back, they can enter and return with the knowledge that they'll be debt-free. So it's a very nice model, right? Individual donors, several dozen, but I think it's a model that our medical schools within UC need to take a closer look at, particularly for our prime students, because it could be structured in any number of different ways. In the event that my student decides not to come back to the Inland Empire, he's simply left with his debt, and the funds revert for availability to award to a student who will. If he leaves after 1 year, he gets a year's worth. If he doesn't complete the full term, that becomes a loan. So it's very transparent on the front end, and it becomes feasible for a business or for a donor to have a connection with an individual student.
I think that we are suffering a little bit from trying to solve some of the short-term problems with scope of practice, change, patient-centered medical home, a little better education this way and that way. When the problem is we're suffering from a trickle-down process in regard to medical students. Trickle down from schools to the Central Valley. And what we ought to be doing is starting a medical school here to do all the things we know that medical schools can do. So I would just like to say, we're ready, and we look forward to your support on this process.
Dr. Blossom's right. This is all trickle-down stuff. If we don't figure out a way to build a medical school right here in this city, on this campus, on this property, and start training Central Valley kids, our own children, to stay in this valley and go to med school here and then stay here and do their residencies, we'll be doing all these other kinds of games that we're having to play to get folks to come here to be trained as primary care providers to solve this workforce problem. I've been doing this for 44 years. Every square foot of this Central Valley is a health professions shortage area of one kind or another. Mm-hmm. And unless we, and Dr. Peterson's absolutely right, or John's absolutely right, this area is not the most attractive. We all are parents of kids who went to school here, grew up here, and then decided to go to San Diego State and never came back home, okay? So Central Valley kids oftentimes are looking for opportunities to leave. You're wonderful, doctor. You went away and you came back, and that's terrific. But you are one of a few. And we have to have opportunity for local kids to go to med school here and to stay here and do their professional postgraduate training and then stay in service to the populations that they love and come from.
Every day in clinic, yeah, Mr. Mendoza, Mr. Singh, Mr. Mua, they come with different complaints, right? Chest pain, shortness of breath, and it's really interesting to learn about the pathology. But once you talk to them and you learn about them and what they do for our valley and what they do for our nation, I think that's my drive to continue going. When it's been 16 hours working and I'm really tired, I'm really not excited anymore about the pathology. I'm really excited to talk to my patients, to come and check on them, to come and see all of the disparities and all of the strength that these people have within them. So I'm really in great support of the medical school here within the Valley. And I think, yeah, we should address all the health disparities, but we should also address the needs of the strength of the Valley, which is their people.
You know, I've dedicated my life to trying to make the Central Valley a better place to live and work and raise a family. I live in the Tower District. I kind of grew up off of Belmont and San Pablo. The conditions I grew up in are much like the ones our patients go through, and I'm excited that we have all come here today to be part of a broader conversation about improving our community.